Inside my head or inside my brain is that part of me which keeps me sane, which helps discern between right and wrong and other things I'm gonna talk about in this song. It's time for the people to know, so now I tell them what goes on in my cerebrum and my cerebellum, the thought process that helps me get dressed, get up, and go to school.
Welcome to the Mental Weight Room, where we train our brains just as hard as we train our bodies. My name is Antoinette Datoc, and today my guest is Dr. Caleb Kutsche, a sports performance physical therapist and founder of Incline Performance Therapy in Woodstock, Georgia. Dr. Kutsche specializes in elbow and shoulder injuries in baseball players, and his mission is clear: to help athletes not only get healthy, but stay healthy throughout their careers. But here's what makes Dr. Kutsche stand out. His work isn't just about injury prevention or rehab. He believes deeply in helping athletes realize that their identity is not tied solely to their sport, that there's more to life than baseball or any game we play. We'll be talking about some crucial concepts today, from understanding acute to chronic workload ratios, to the value of maintenance programs, and of course, the importance of having a healthy mindset both on and off the field. First of all, Dr. Kutsche, thank you for being with me today. I appreciate it. I know you're busy and it's early in the morning. I've got my coffee. I don't know if you have yours for people listening and watching.
I got mine too. Yep.
Good.
For sure.
Good.
Thank you so much for having me on here. This will be my first podcast that I've been a part of. So
Okay.
I'm excited to get started.
You.
Yeah.
It's your podcast baptism. All right. Well, let's start with your origin story. What inspired you to work with athletes, particularly baseball players, and what also inspired you to start Incline Performance Therapy?
Sure. So I played baseball my whole life. And actually at 9 years old, I was in a position where I got to witness one of my teammates injure himself. He had an elbow injury, and through that whole process of him being pulled off the field, basically in tears, and coming back, I learned about the profession of physical therapy. And I learned that there was a job out there that basically, helped athletes get back to full health, get them back on the field. And, I didn't have to sit at a desk my whole life. So that was automatically appealing at that age. And playing baseball throughout my career into college, I learned a lot about the human body. And it really drove my passion, dealing with a couple minor injuries myself, to get into the rehab side of things and help get baseball players, but other athletes back on the field.
Okay. So you often say there's more to life than sports. What led you to that belief, and how do you communicate that to the athletes you work with?
Yeah, so my personal faith, I'm a Christian, and I've been in church basically my whole life. And, having some injuries myself, but honestly, you get out of baseball, at some point your career ends, whether it's through injury or it's just your time runs out. And you have to kind of look at yourself and say, okay, is there, what am I going to do now? Who am I going to be at this point? And fortunately for me, I have my faith and I have my identity, in Christ. And so it helps to know that whether, I succeed on the field or if I don't, or if my business succeeds or not, that there is more to life than just, numbers and performance in that sense.
And results.
So that really has been the key foundation. Well, yeah, exactly. So results are, the byproduct of all the preparation you put in. But some of those are outside of our control. And so if we don't have control of the results in all cases, there's only so much we can do.
We only have control over the process, right? What we do and what we think and what we believe. So I'm right there with you. Have you found, though, that athletes, especially young players, struggle with wrapping their identity around their performance? And how do you help them navigate that?
Absolutely. That's a great point. A lot of times when I get athletes in the clinic here, they've taken a major identity hit because they identify themselves as a baseball player or a soccer player or whatever. And when that's taken away from them, usually temporarily, sometimes permanently, they don't know what to do with themselves. They don't know what to think. Their competitive outlet is taken. And that's just a prime opportunity that I have to talk with them, not just about rehab, but also about, things that are beyond their sport,
Right.
potentially spiritual things, but oftentimes just building confidence in themselves and not just their athletic ability.
Right. Just understanding that you're more than a baseball player. You're a human being with lots of different aspects. Yeah. I want to shift a little bit to the acute to chronic workload ratios because I found that interesting. I had never heard of that term before, so I did a little research. But for those who may not be familiar, you're more of an expert, obviously, than I am. Can you explain what acute to chronic workload ratio means and why it matters?
Sure. Yeah. So acute to chronic workload ratio basically is if you take the total amount of stress or work performed in the past 7 days and you compare that to the prior month, you basically can get an idea of if you're stressing your body too much or too little. And why that
Okay.
matters is if we're trying to reduce the risk of injuries, then we don't want to train too much and we don't want to train too little
Too
because
little.
long
Hmm.
term, too little training will lead to weakness on the field and put you at risk. And then training too much, you could lean to overtraining and burn out a little bit faster. So we
Yeah.
want to maintain a good kind of even training load that is progressing enough to build strength and improve their performance.
Without knowing it, you answered my next question, which was how do you use this concept with athletes you train and treat? But now let's talk about maintenance programs since you talked about maintenance. A lot of athletes and parents think you only see a physical therapist when you're injured. So, how do you reframe that mindset? Because it seems that you do a lot of what I would call prehab. And I never really heard of that until my son got to Georgia Tech and started playing baseball. So how do you reframe that mindset?
Obviously, I love helping athletes recover from injury, but I
Right.
would really love it even more if they never got injured in the first place.
Right.
And it turns out it's really difficult to predict if someone's at risk of an injury. And
Okay.
so I've kind of specialized in baseball players, and some things that we have found with baseball players is certain ranges of motion, internal and external rotation of their shoulder, elbow extension, shoulder flexion, and certain strength metrics. We can
Okay.
measure all of those things and get precise numerical values to those. And then based on that, we can create an exercise program or a soft tissue program to put them at the most ideal point to reduce their risk of injury. So
Okay.
it's kind of a cool process that not many places are doing. But again, the goal is to prevent injury rather than have them recover on the back end after taking
Right.
6 months off.
Right. So do you collaborate with some of the speed and agility and training centers in the area, or do you implement those training programs yourself at your facility?
So I'm kind of in the gray area between typical physical therapy and the sports performance. I
Okay.
found that there was a chasm, so to speak, between if you're recovering from an injury, insurance might get you so many visits and then you're done and they kick you out, but you're not really ready to get back on the field at a high
Right.
level. And so my goal would be to, fill that middle ground between the standard physical therapy, rehab, and then getting kids ready to perform and ready to get back to the field.
Okay. Okay. So, how do you balance pushing for progress with protecting for long-term health?
So that kind of goes back to that acute to chronic workload ratio
Yeah.
because we can specifically measure how much stress they're putting on their body or on their arm
Okay.
over a season or over an off season or whatever. And you can measure that with strength training programs and you can measure that with actual throwing stress, right? So there are different monitors. Driveline has a good monitor that they're using. Mine is a little more, I guess, economical for maybe a team setting, but we just measure that stress load, and if someone's veering too far out of that range, we just reel them back a little bit. And uh, ideally, we've had good results so far.
Okay.
We're always looking to improve that process, though.
Right. Let's talk a little bit about the intersection of mind and body. There's no disputing there's a really strong mind-body connection, right? From your perspective as a doctor of physical therapy, how important is mental performance and those mental skills in injury prevention and recovery?
Yeah, it's super interesting. They've done a lot of studies in terms of practice and how mental practice can improve performance, even upwards of being 50% as effective as actually performing the task. And
Right.
that's super interesting. And I think it's very valuable to have kids who are injured specifically mentally go through some practice, some mental practice, to see themselves performing well on the field, to envision them throwing each pitch, throw their fastball, throw their curveball, and then not just visualizing it, but visualizing it successfully.
Right.
And if we know that we can get a 50% improvement in skill or 50% effectiveness in skill development, then why not do that for the 3 or 4 months that they're injured and not
Yeah.
lose as much progress as you might have otherwise? So
Yeah.
it's very important.
A lot of times kids who are injured, they can't get on the field or they can't practice, and their parents will say, well, what are you going to do while you're recovering? And so they work on their mental skills and they come to see me. And that's a big part of what I do. It's fascinating how sport visualization or visualization for anything can really accelerate recovery, performance, skill acquisition. What role do you see that collaboration plays between, say, physical therapist, strength coach, and mental performance coaches like me?
So I think the collaboration is key. I think fundamentally we each have our own areas of expertise,
Mm-hmm.
and knowing where our expertise is and knowing where it's not is super critical.
Yeah.
Um, because I know a decent amount about nutrition, but I am not licensed in that area, so I'm not
Right.
going to recommend specific food plans. And I'm an expert in prehab and rehab, but there are areas of the mental side of the sports that I'm just not qualified to instruct. So knowing that limit on myself and having someone like yourself to refer to would be a key component of any rehab process.
Right. Right. Dr. Kutsche, thank you for being in the mental weight room with me today. Your insights remind me that staying healthy isn't just about stronger shoulders or better mechanics, but about understanding who we are beyond the game. What's the best way for folks listening to connect with you or learn more about you, your work, or Incline Performance Therapy?
Sure. So I have, I guess, a website, which is at inclineperformancetherapy.com, and then Instagram. I think it's Incline Performance Therapy. Also has a lot of my videos, and I put a lot of educational material out there as well. So those would both be great places to find me out.
Okay. And as we wrap up today's episode, here's what I hope my listeners will take. The best athletes aren't just physically strong, they're grounded, self-aware, and intentional. Dr. Caleb Kutsche reminded us that longevity in sports isn't just about avoiding injury, it's about seeing the bigger picture. Your worth isn't defined by your stats or your schedule, it's defined by who you are when the lights are off, the crowd is gone, and the game is over. That mindset and the work you do in the mental weight room is where real transformation happens. If today's conversation challenged or encouraged you, take one small action. Ask yourself, am I training for the next game or for the long game? If you're enjoying the mental weight room, share it with a friend or teammate, leave us a review or tap a 5-star rating, and don't forget to subscribe or follow us on social media so you never miss a mental training tip. Thanks again for tuning in. I'll see you next week. Same time, same mindset. This is Coach Antoinette and Dr. Caleb. And until next time, keep training your brain and keep pushing your limits.